Well, the Democratic Alliance in Gauteng yesterday blamed the Provincial Health Department for not blacklisting companies implicated in corruption tenders. The party says not a single company has been blacklisted, including those implicated in the R1 billion irregular spending at the Tembisa Hospital. Now, Morning Live invited the Gauteng Health MEC, Nomantu, Nkomo, Ralehoko, but the department said she was not available. The department has, however, responded that none of the companies implicated in corruption at the Tembisa Hospital are recorded on the Restricted Supplier and Tender Defaulter report. The department says it cannot record companies on the list, but reports them for blacklisting via the National Treasury, and the Treasury's requirement is that only confirmed cases can be blacklisted to avoid litigation. So the department says it awaits final SIU reports before reporting the said companies. Now, the DA shadow MEC on health in the Gauteng Provincial Legislature, Jack Bloom, joins us to speak about this. Thanks very much, and it's good to have you on the program.
Good morning. Good to be with you.
So the Gauteng Health MEC has responded to your question where you asked for details of the number of companies found to have benefited from the R1 billion tenders that were irregularly issued by the Tembisa Hospital. But the department says a company can only be prevented from doing business with the department if the matter has been investigated and if the investigation report recommended that the company must be prevented from doing business with them. Is this a fair response?
Well, you know, they gave me the list of companies on this restricted supplier list, the blacklisted companies, and there's 93. But not a single one over these many years has been put there by the Gauteng Health Department, whereas the Western Cape Health Department has put 18 companies on the list. 2 DA-controlled local municipalities, including Midvaal, have put 5 companies each on this list. I have to ask myself, there's been many confirmed cases of corrupt tenders in Gauteng over these many years, and the Gauteng Health Department has not put a single company on this restricted suppliers list. So it shows me that they don't take corruption seriously, and that many of these companies with confirmed cases against them probably still get money from the Gauteng Health Department. And I would think that when it comes to the Tembisa Hospital companies, that there's some sort of red flagging of them, because the evidence is quite overwhelming. I think if you have to wait for a court case every time, I mean, a lot of companies are still going to get away with outrageous things against the department. Are you not going to subject them to extra scrutiny at the very least? But it seems to me that they're not serious about fighting corruption at the Gauteng Health Department, and that's why we get scandal after scandal. And it's not just Tembisa Hospital. There's been so many scandals over the years that I really can't believe that not a single company has been confirmed that they could put on this tenders list, and they haven't put it on this restricted tenders list.
Yeah, that's a bit of a worry. It really is a worry that people can literally get away with this fraud and corruption and still carry on working. I mean, do you have examples of companies that in fact are still getting tenders and are still providing, even though they have been implicated?
Well, that's my next question, the Gauteng Health Department. I'm going to do some follow-ups. I'm going to take companies that have been proven to be involved in corruption. I'm going to ask if they've received tenders ever since. I suspect many of them have. You know, even with the Tembisa Hospital corruption, we know that at least from October last year, some of them were still getting contracts from the department. But as I said, you really have to wait for a full SIU report and the matter goes to court and everything is like absolutely confirmed. You can certainly put them on some sort of list where you scrutinize them a little closer when they next put a contract forward. But as I said, I don't think the Gauteng Health Department is serious about fighting corruption. The department reminds me very much of Eskom. I think that there are very entrenched internal corruption networks, and they receive political protection, and that's why you find the same companies just get more and more money from the department, or sometimes what they do is the directors just form another shelf company. We've seen this at the Tembisa Hospital, and even if the original company was put on a blacklist, which it hasn't been put on a blacklist, they find ways to get around it. So I think they've got to get serious about fighting corruption. They've got to get serious about scrutinizing companies that put forward overpriced tenders, and make sure that money goes to treat patients at Gauteng, because the real victims of all this are patients of Gauteng who get a terrible service, unfortunately, because the money's being stolen.
In December, the SIU, with the Gauteng MEC, Panyaza Sufi, who was the MEC at the time, released preliminary reports of its investigation into the Tembisa Hospital corruption, confirming that possible fraudulent payments were made to fraudulent suppliers. So the SIU identified payments worth more than R1 billion to syndicates of business people who operated a range of companies trading with the hospital. But now the department says it awaits the final SIU report before reporting those companies. And the department says it cannot act on any of those preliminary reports, despite the actual findings. It's a hard pill to swallow, that one. I mean, surely you should suspend trade with any of these businesses until it's proven that they did not get involved in corruption.
Well, that's what you would think, but, they're waiting endlessly for final reports. The president of this country hasn't even extended the terms of reference of the SIU investigation. This is months later. So we had the interim report in December. Why aren't we even getting the proclamation to have the continuing SIU investigation? So this is actually what really happens in that department. There's endless investigations. It never comes to a finality, and people are never faced with the consequences of their action. So I think to take an example of the SIU report in Tembisa Hospital, of course they should have put them on some sort of extra scrutiny list at the very least, that if any one of these companies ever tries at any other hospital in Gauteng, you take extra care to look at what they're doing. And but the Gauteng Health Department has said, I don't think they care about fighting corruption. It's too many of their friends are involved, and that's why of the 93 companies that we do have on this list, not a single one from the Gauteng Health Department, and 18 from the Western Cape Health Department. So there you see a department that is serious about fighting corruption. They get clean Auditor General reports, unlike the Gauteng Health Department, which gets a terrible Auditor General report every year. And that's why you see there's no improvement. There's simply no consequences for wrongdoing when it comes to corruption.
Yeah, so that's the issue of the Tembisa Hospital, which, as I said at the beginning of the interview, we did ask the Gauteng Health Department to come on, but this is the same reasoning you've gotten is what we got, that they can't actually talk. They're still waiting on Treasury for that. But another matter, I mean, earlier this year, you actually called for the security company at Charlotte Maxeke Hospital to be fired after yet another major theft of copper pipes worth R3 million was stolen from above an operating theatre. I mean, this is on the back of last year's theft of copper cables worth R30 million and equipment worth 200,000 rand from the hospital. How's the government dealt with these thefts and the security company? Are they still operating?
Well, here's another example of no consequences. All the security contracts at Gauteng hospitals were awarded in 2014 for a 2-year contract that was supposed to expire in 2016. Then they did an investigation which found that these contracts were awarded irregularly. All these contracts were awarded irregularly. But what did they do? Instead of, consequences and blacklisting these companies and putting out a new tender, they just rolled over month by month since November 2016. It's now going on for nearly 7 years that all these security companies that wrongly got awarded security contracts at hospitals were regularly extended their contract month by month for nearly 8 years. And every year, the Auditor General condemns it as irregular expenditure. And every year, the Gauteng Health Department does nothing about it. And that's why I think that at hospitals like Charlotte Johannesburg Hospital, and you'll find other hospitals as well, we get poor service. I think we're grossly overpaying. We pay about 30 million rand a year for security as at Johannesburg Hospital. But look at the poor service you get there. I think there's inside jobs. I think there's obviously collusion. Enormous amounts are stolen, piping. The value is very high. And we have to worry about the security of staff and patients at the hospitals as well. So, I've called time and time again for all the security contracts to be re-advertised. They can't go on where contracts awarded in 2014 are just endlessly extended, despite the fact that we're overpaying and getting poor value service for it.
Yeah. I mean, these thefts that we're talking about have been ongoing at Charlotte Maxeke, despite spending more than 30 million rand a year at this hospital, which is supposed to have functioning security cameras at key locations as well. I mean, my question to you is, how is it possible to steal and vandalize a hospital with security companies, paid this huge amount of money and cameras put in the hospital, allegedly? This is per year, and it's still happening. It's so hard because, as you say, I mean, this is patient and staff security at the end of the day that is under threat as well. And it's not that the money isn't being spent on security. It is being spent, but the security does not seem to be doing its job.
Well, I think there's collusion. Obviously, there's some people, maybe in the security company as well, who are colluding in this. That's why these thefts continue to happen. But look, I've also called now for the removal of the hospital CEO of Charlotte Johannesburg Hospital. There's been no consequences for the fire that happened there. There's no consequences for this. I've just found out from a reply to my question, there's more than 700 vacancies at that hospital. We just have poor CEOs at our hospitals. The health ombudsman made the observation that they've lowered the standards for selection of CEOs. He made some devastating remarks about how the CEO of Rahima Musa Hospital was selected. It's a buddy-buddy system, to be honest. It's a cadre deployment. So I think it's time that Charlotte Johannesburg Hospital got a decent CEO. There's been resignations and transfers of CEOs at the other three academic hospitals. Now, once and for all, can we have a decent selection process and get very capable CEOs who are capable of, ensuring the security of the hospital, filling vacancies, and make sure that there's no corruption and that patients are decently treated. That's what we're asking for, and what we don't get from the Gauteng Health Department, because I just think that right at the very top, that's where the rot is, and they're protecting corrupt and incompetent people, unfortunately.
You say that there may be collusion, that this is something that may be an idea of corruption, once again. Do you have evidence of that? I mean, are you just saying it as a comment, or do you actually have evidence that perhaps there is collusion between the security company and somebody perhaps is benefiting at the department or at the hospital level?
Well, I think it must be the natural suspicion that this is happening, and it should really be investigated. But, there was a police investigation which was actually covered up. It was only leaked by journalists of the fire at Charlotte Johannesburg Hospital, and they say it was arson. Now, again, that's a failure of security. Now, I mean, some people at the hospital say that, in fact, the fire was started at the stores to cover up evidence of corruption at the stores section of that department. So this is very, very serious. I think we need to, explore why there's such poor security at the hospital. In fact, there was supposed to be a follow-up report of the fire at the hospital, and that hasn't happened either. So, it all looks like a cover-up. They're protecting their buddies, and they don't want to get to the root of the problem, and people suffer because of this.
Yeah, which is a problem, as you mentioned, that these contracts at the hospitals get signed month to month, because 6 years ago these were meant to go up for advertisement to get new security companies in. 6 years ago. Is that the case at Charlotte Maxeke or at all of the hospitals that should have a new security company put in place, but they just haven't put that out to tender?
Well, it's at all the hospitals. So every year the Auditor General classifies it as irregular spending, and it's a lot of money. It's 300 to 400 million rand every year. And he says you've got to do something about it. And every year the Gauteng Health Department doesn't do anything about it. So I have put in a question for this that the MEC will be required to answer. I'm saying, well, when are you re-advertising these tenders, and how can you continue paying out irregularly companies that were found to be irregularly appointed in the first place? So, I mean, this is just an ongoing scandal. It's an ongoing scandal of many in that department. And to be honest, I don't think there's the political will in that department to do what's required. And I think it needs a change of provincial government with Gauteng before you're going to get any action. As I said, it reminds me very much of Eskom, deeply entrenched corruption networks that receive political protection.
All right, we've got to leave it there. Jack Bloom, thanks for talking to us. That was, of course, the DA shadow MEC on health in the Gauteng Provincial Legislature, Jack Bloom, on resolved theft and corruption cases in the Department of Health here in Gauteng, with particular reference to Tembisa Hospital, that we've still got companies that have been accused of fraud still getting tenders, and then, of course, the security at Charlotte Maxeke Hospital, and the fact that that is still ongoing, even though there have been calls to find new security companies.